Welcome to Unit 3, Cryotherapy. In this lecture, we're going to talk about icing, how and when to use it, its effects, contraindications, and adverse reactions. This useful tool is generally best used in the early stages or the acute phase of an injury, but there are exceptions to this rule. There isn't a huge amount of research on icing injuries and the benefits, but it is simple, easy for the client to do, inexpensive, and as a general rule, it's safe. There's been some discussions that say you shouldn't interrupt the inflammatory process with icing, as it slows the healing process down, and others that think it's a miracle cure. I think it probably lies somewhere between these two extremes. A lot of the benefits will depend on whether it's an open or closed injury, how the icing is carried out, and what your actual expectations are from the treatment. In some cases, the body can get a little overzealous with the healing process, and easing it back a little bit with icing will actually help. The suggested benefits of icing are a reduction in perceived pain. This is probably the most beneficial use of ice. This is the initiation of the pain gate theory. Vasodilation of the blood vessels, which in turn reduce blood flow to the area, helping to reduce swelling and helping to reduce muscle spasms. There are a variety of ways to ice, including crushed ice, frozen peas, other vegetables are available, wrapped in a damp cloth or towel, ice packs, reusable or one-use. The one-use packs cool instantly by snapping a disc inside them, so they're quite handy if you don't have a freezer. Maybe if you're working pitch side, they could be useful. You have things like ice baths for plunging, ice gels and ice sprays. They aren't as cold as your ice packs, but they could be handy. Cryo cuffs, which tend to be used more in a clinical environment or with professional athletes. And the other option that you can use but should be used with care is ice cups. So how do you use these methods? Ice packs, crushed ice and vegetables is quite simple. You wrap it in a towel and you lay it on the affected area for as long as you need. Cryo cuffs generally have a container filled with ice. Then there's a cooling cuff that you can wrap around the injured limb. Not so great for a trunk injury. Gels and sprays are generally rubbed or sprayed on. I have a client that plays golf, and he will carry a gel or a spray in his golf bag with him because he does have issues on and off, so it's quite handy in that respect. So all of these methods can be used on any area of the body, regardless of the injury being deep or superficial. You then have ice baths that you jump in, rather you than me. These aren't generally used for specific injuries, but are used after training to reduce inflammation in the muscles from micro tears. And finally, we have ice cups. So you can actually buy a proper cup in America for this, but I've never seen them over here. You might be able to get them, I don't know. So what you'd have to do is fill a disposable paper cup with water and freeze it. Then when you come to use it, you cut the first inch or so of the cup off to expose the ice. Care really needs to be used with this one because it's used directly on the skin, so there's nothing between you and the ice. They're only really suited for superficial injuries rather than deep issues because the ice has to stay moving and it can't stay on the skin for very long, so it only stays on for a couple of minutes. If you don't keep it moving and you leave it on for too long, you're likely to get ice burns. I'd completely forgotten about this method until I started pulling together my thoughts for this lecture, and I actually remember being taught ice massage on one of my first courses. It really does sound grand, but it's not. It's basically doing what your client would be doing, but for them. If you do ever use this treatment, make sure you wrap the ice cup in either a flannel or a small towel just to protect your hands from the cold. So how do we know when we've iced enough? It will depend on the muscle and the area being iced. So, for example, if it's a large muscle that's very deep, it's going to take a lot longer than a very superficial thin muscle. So it normally stays on for anything up to 20 to 30 minutes, but it could literally be a couple of minutes. So the client will go through 4 stages, or they'll feel 4 stages. So the first one is the sensation of ice. The second one is a kind of burning, prickling feeling from the ice. Then you have the achy feeling that you get with ice, and finally numbness. And numbness is the one that you're looking for. So once it becomes numb, you remove the ice. And like I said, anywhere from literally 2 minutes to 30 minutes. So how often should someone be icing? This is a really good question. So the most important thing here is how much time your client has to ice. So if they could only ice once a day, don't tell them they've got to ice 6 times a day, because they'll never do it. Tell them they can ice once a day and that will do. But you can ice as often as you like, really. The skin has to return to room temperature. So they say generally every 2 waking hours. So as long as the skin returns to normal temperature, you can then re-ice. There are a few general application rules you should follow. To prevent ice burns, there should be a barrier between the skin and the ice. A towel, cloth or sleeve can be used, except obviously in the example of the ice cup. You should always place the ice on the area rather than the area on the ice, so don't lie on it. This can cause a pressure area, which means it will cool too much and may cause burning, but also it'll slow the blood supply too much to that area as well. You need to regularly monitor the area to ensure circulation hasn't been reduced too much. Make sure the ice is kept on for the appropriate length of time, so too long you're likely to get ice burns. Not long enough and it's not going to be effective. I've seen a few ice burns in my time as well, and they generally do mark for life. Finally, when dealing with an injury, it's important to get the ice on as quickly as possible after the incident. So if you're pitch side, great. If you're not, you'll need to give guidance accordingly. Before we move on to contraindications, I mentioned a term at the beginning, the pain gate theory. This is a theory that was first introduced in 1965 by Melzack and Wall. That suggests there are inhibitory neurons at the level of the spinal cord, the gate, that can be stimulated to close by using other sensory outputs such as temperature, touch, pressure and vibration. This prevents or reduces the pain signals from reaching the brain. So not only can ice be used this way, but also heat and massage. They just need to be introduced at the right time within the injury. Okay, so when can't you use ice? What would be considered a contraindication to treatment? Potentially the elderly, due to the skin being thin and poor circulation, but please do not lump all the elderly together. Some are very fit and others not so. Cardiac conditions such as poor circulation or angina, circulatory problems, anyone with Raynaud's disease is a real no-go. Uncontrolled diabetes or diabetics with neuropathies, so that's damage or impairment to the nervous system. Reduced sensation, people that have had radiotherapy or chemotherapy recently, their skin can be very damaged, extremely painful and sensitive after treatment, so this is a definite no-go. Damaged or limited sensation in the treatment area because they can't feel what's going on. Open wounds or damaged skin. This is partly because you want the full inflammatory process to take place in case there's an infection, but also it's going to be potentially much more painful and you may cause more damage to the tissues. Basically use some common sense when advising clients on using ice. If they have damaged skin or sensory issues, it's probably a no-go. If you're not sure and you think ice would be really beneficial, then they need to talk to their GP. That's the reasons not to treat with ice. And here are potential adverse reactions from treatment. If good advice is given, then none of these should really happen. So be clear with your instructions, maybe even have written information available for your clients. Most of these will be caused by icing for too long or not protecting the skin from the ice. And this will include ice burns, which is going to be the most common out of all of them. You then have things like loss of sensation, discomfort or pain, sudden increase in blood pressure, uncontrolled shivering, tiredness and fatigue, abnormal breathing patterns, confusion and irregular pulse. So these are all really, really rare. So don't be put off recommending this treatment to your client because it might be very useful for them. These are generally signs of hypothermia and only occur if the treatment for whatever reason has been inappropriate. Whether this is an underlying unknown condition, so this is not your fault, but it might be good for the client because it will send them to get themselves checked out, or poor use of the therapy. If a client does exhibit any of these reactions from treatment, it should be ceased immediately and the cause determined, and this really should be through a medical professional, so they should seek professional medical advice straight away. So there you have cryotherapy or icing. It's really useful. Hopefully you've gained some useful information. You can now complete the quiz associated with this section and you can move on to heat therapy.